Hi everyone, the topic for this video is antiarrhythmia. In this topic or in this part of antiarrhythmics, we will see normal heart, how does it function and symptoms of arrhythmia. So before going into arrhythmia, we will first see some functional features of a normal heart. How does it function? Uska action potential, uska ECG, electrocardiogram, how does it look in a normal person, healthy person. So in normal heart, how the action potential looks like. Now there are two action potential graphs here. This one is for pacemaker cells in the SA node and AV node, and this one is for myocytes, the cardiac cells, normal cells, which will contract. The video action potential video in which we had seen details about the action potential, that was about myocyte. So myocyte के action potential में क्या होता है? We have already seen sodium in, that is depolarization, followed by which calcium is also coming in. After this, to compensate that, potassium starts going out, but initially calcium is still coming in because it's a slow channel, so there is a plateau, and later on when finally calcium channel closes and it's only potassium which is going out, so there is repolarization and then resting potential finally after repolarization. So this is about normal myocyte. पेसमेकर में डिफरेंस क्या है? सिर्फ ये प्लेट्यू फेज नहीं होगा. द प्लेट्यू फेज विल नॉट बी देयर इन द pacemaker action potential. So that's the only difference between these two, but action potential is something which we have to remember nicely, that what is phase 0, what is phase 1, what is phase 2, and what is phase 3 and 4. So then only we can correlate कि antiarrhythmic drugs देने के बाद कौन से phase पे उसका effect होता है. That is important from GPAT point of view. Arrhythmia में electrocardiogram, which is also known as ECG, वो भी बहुत important है because it actually shows the rhythm of heart. So generally हम जो labs में test करवाते हैं, ECG test, उसका report अगर कभी देखा हो तो that shows these three significant waves: P wave, Q, R, S wave and the T wave. So इसमें P wave जो है वो क्या दिखाता है? It corresponds to atrial depolarization. The QRS wave represents depolarization of ventricles, and the T wave represents repolarization of ventricles. So these three are important waves in ECG. Occasionally arrhythmia is asymptomatic, कोई symptom नहीं होता है, but most of the time these symptoms appear in arrhythmia patients. They feel breathlessness, that is difficulty in breathing. They feel dizziness or faintness. They feel their heart is racing fast, that is the scientific term for this is palpitations. Tiredness or fatigue or weakness, chest discomfort and difficulty in exercise are some other symptoms of arrhythmia. Hello everyone. So in second part of this topic, antiarrhythmics, we will see causes of arrhythmia. What are the causes of arrhythmia? This is one important part. The concept is very important. Here there are three categories of causes. First is enhanced automaticity. Second is after depolarizations, which may lead to trigger the automaticity, a new action potential, and the third cause is re-entry. So let's see all these three in detail one by one. First thing, what is automaticity? So it is ability to spontaneously generate an electrical impulse. that is depolarization. जो depolarization या contraction इनका impulse generate होता है automatically in the heart, that is called automaticity. Now what is enhanced cardiac automaticity? जहाँ पे ज़्यादा ही action potential generate होने लगता है, more than the desired. So accelerated generation of action potential, that is enhanced automaticity. It can be because of the pacemaker tissue, some problem in pacemaker tissue, then it will be called enhanced normal automaticity. अगर कोई और abnormal tissue है heart में which is causing this enhanced automaticity, then it will be called enhanced abnormal automaticity. This can be due to few causes are mentioned, few reasons are mentioned over here for enhanced automaticity, that is beta stimulation, or sorry, super stimulation, super sensitivity of the heart to beta 1 stimulation, or hypokalemia. So here you can see this is one action potential, and ideally in normal person इतना resting stage के बाद next action potential start होना चाहिए, but because of this super sensitivity to beta 1 stimulation or hypokalemia, the next action potential is started very quickly, so the heart rate is faster now. So arrhythmia का first cause था enhanced automaticity, second cause हो सकता है after depolarization. So after depolarization means depolarization that follow the cardiac action potential. So you can see here one depolarization, the action potential is there, and before it ends there is another action potential which is starting, another depolarization which is starting, right? So there can be two types of after depolarization: early after depolarization and delayed after depolarization. Early का meaning क्या है? That means before this action potential is ending, ये खत्म होने से पहले ही next depolarization start हो गया है. Okay, यहाँ पे if this depolarization का potential reaches to the threshold potential, okay, suppose this is reaching to minus 70 millivolt, then this will be getting converted into second action potential. So क्या हुआ, ideally अगर इस action potential को यहाँ से start होना था, okay, like this, but what happened, because this depolarization is over here which has reached to threshold potential, this will here itself it will get converted into next action potential. So what is happening, early contraction, right? The more number of heartbeat will be there. Ideally इतने टाइम के बाद होना चाहिए था, but because of this depolarization, early depolarization, after depolarization, it's here itself the action potential. So this is early after depolarization. If you this early after depolarization is happening generally during phase 2 or phase 3. Okay, so phase 2 or phase 3. Now coming to delayed after depolarization. इसमें क्या difference है compared to early? This action potential will start once the previous action potential is over. The membrane comes to resting potential, तब आएगा. The only problem here is ideally इसको भी maybe यहाँ से start होना चाहिए था after some time the next action potential, but here itself the depolarization happened, it reached to threshold potential, and that's why it got converted into action potential here itself. So क्या हुआ यहाँ, after some time next action potential should have been there, but here itself there is next action potential, next contraction, so rhythm is higher, the heart rate is higher, leading to tachycardia. So this is all about after depolarization. if this after depolarization is reaching to threshold potential, it will trigger another action potential. So enhanced automaticity after depolarization, and the third one is re-entry. Re-entry का meaning क्या होता है? The third cause in this, generally healthy patients में action potential, the impulse which is generated in the SA node that passes through AV node and to the ventricle wall and then ends. Okay, एक impulse generate हुआ, वो पूरे heart wall में spread हुआ and then it ends. Re-entry में क्या होता है? The impulse which is generated वो वेंट्रिकल वॉल तक जाता है और वो वापस घूम के हार्ट वॉल में एट्रिया में आएगा या फिर वेंट्रिकल में आएगा. सो दैट इज कॉल्ड री एंट्री. द सेम इम्पल्स विच इज जनरेटेड वो सिर्फ एक बार कॉन्ट्रैक्शन नहीं कर रहा है, इट इज री एंटरिंग इन द वॉल एंड कॉजिंग कॉन्ट्रैक्शन अगेन. दैट्स re-entry. Now re-entry के तीन mechanism है that we will see: circus movement re-entry, functional re-entry and atrioventricular re-entry. This is generally seen in Wolff-Parkinson-White syndrome. First one is circus movement re-entry. In this, one important basic term we need to understand is refractory period. Refractory period is the time interval following excitation during which the cell remains unexcitable. That means excitation हुआ यहाँ पे, contraction हुआ यहाँ पे, cell excite हुआ, यहाँ से लेके यहाँ तक, till this time period the cell is unexcitable. cell वापस excite नहीं हो सकता है. क्यों? क्योंकि already ये excited state में है, right? So this period is refractory period. There are two parts of refractory period. First is absolute refractory period and second is relative refractory period. Absolute का क्या मतलब क्या है? It is completely unexcitable. So अब देखोगे जहाँ ये phase 0, 1, 2 और 3 है, इतने दूर में ऑलरेडी ये एक्साइटेड स्टेज में है. सो नेक्स्ट एक्शन पोटेंशियल जनरेट होने का सवाल ही नहीं है. नो पॉसिबिलिटी, राइट? सो दिस इज कॉल्ड एब्सोल्यूट रिफ्रैक्टरीनेस. द लास्ट पार्ट ऑफ दिस एक्शन पोटेंशियल, दिस पार्ट where it is actually going below the refractory below the resting potential and then it is coming to normal potential. So this is hyperpolarization. Okay, the resting potential is -90 and this is below -90. So in this stage also next action potential cannot be generated, but if greater stimulus is given, then here next action potential can be generated. So ideally this is refractory period, but if more bigger stimulus is given, then next action potential can be generated here also. So this is relative refractory period. So what we need to important take home message for refractory periods is that during refractory period next action potential cannot be generated. Okay, so in circus movement re-entry, exactly what happens here we will see. First, in healthy person, this is atrium and this is AV node through which the impulses pass through ventricle wall, right? Now in this junction in the AV node, यहाँ पे जो impulse का pathway है, that is actually divided into two pathways: fast pathway, slow pathway. So if you see, slow pathway is blocked in healthy person. ठीक है, fast pathway means that is the regular pathway and slow pathway is slower compared to the regular pathway, regular speed of the impulse. So here if you see in healthy person, see with focus how the impulse is passing and how the it is generating action potential. Okay, so here the impulse is passing through fast pathway and it is causing one action potential, one impulse, one action potential, right? Now if we see when there is circus movement re-entry, okay, so here see in the impulse how it is coming from atria, okay, from AV junction, it is divided into two parts. The impulse is fractionated into two, and one is going through the fast pathway, other is going through the slow pathway. And the one which will go through slow pathway, that will come back to through this fast pathway. See carefully. So you can see when one part of the impulse which was coming from fast pathway, it generated one impulse, right? And the part of impulse which came through slow pathway, that re-entered through AV node to the atria. वो यहाँ पे भी आ सकता है और एट्रिया में भी री एंट्री कर सकता है, राइट? बट इट इज अ स्लो वन. So what is happening currently when there is the fast pathway is coming from here, the impulse is coming from fast pathway, there is a refractory period. Ideally in that period next impulse generation should not be happening, but in relative refractory period this slow impulse is coming back here and it is generating the second impulse also. So that is how the two impulses are generated through circus re-entry. I'm just repeating this part. So in functional movement re-entry, it is slightly different from circus movement. In circus movement क्या था, सेंटर में ब्लॉक था एवी नोड के, सो एनाटॉमिकल ब्लॉक इट वाज. उसके वजह से क्या हुआ था, दो पाथ क्रिएट हुआ था राइट साइड में उस ब्लॉक के और लेफ्ट साइड में. with one was fast pathway and another was slow pathway. But in functional movement there is no central block, there is a block on one side, okay, and because of which, and this is not anatomical block, it is actually because of heterogeneity of the tissue. So जो टिश्यू का प्रॉपर्टी है एवी नोड में वो यूनिफॉर्म नहीं है, इट इज डिफरेंट. Tissue over here will function differently compared to tissue over here, and that is why this is acting as a block, functional block. Okay, it does not act as anatomical barrier. Now इसमें कैसे exactly impulse bifurcate होता है और टैकीकार्डिया होता है, मल्टीपल इम्पल्स जनरेशन होता है, री एंट्री होता है. लेट्स सी. सो ये जो इम्पल्स है यहाँ से जनरेट होके ये यहाँ पे आता है नीचे, एंड देन इट इज डिवाइडेड इनटू टू पार्ट्स. वन इज गोइंग डाउन naturally the way it should, and second one, because of this block, it will come here and return and come down. So that is a premature, that acts as a premature beat which will come down. So that will give second impulse, act as second impulse. Okay, just a representation shown here quickly. If we can see here, the impulse is coming down naturally, which bifurcates into two, one naturally going down giving one impulse, and second one which returns from that heterogeneous tissue coming back down giving second impulse. Now what happens in atrioventricular re-entrant tachycardia, which is generally happening in case of Wolff-Parkinson-White syndrome. It is also known as this. So in this what happens, ऐसे नोड से इम्पल्स आया, अट्रिया वॉल पे स्प्रेड होके एवी नोड पे आया. एवी नोड से नाउ जनरली फर्स्ट टू मैकेनिज्म जो देखा उसमें एवी नोड में प्रॉब्लम था, वहां से री एंट्री हो रहा था, राइट? इन दिस केस इट्स नॉट द सेम. It is from AV node, it is spreading on the ventricle walls, and ideally it should stop here. Okay,
यहाँ आने के बाद इम्पल्स स्टॉप होना चाहिए, बट देयर इज सम प्रॉब्लम ओवर हियर दैट बिकॉज ऑफ विच द इम्पल्स इज नॉट एंडिंग ओवर हियर एंड इट इज गोइंग बैक टू एट्रियल वॉल. This is called accessory pathway through which the impulse is going back to atrial wall, and that is called re-entry of the impulse causing tachycardia.